29 shocking human experiments U.S. governments conducted. From 1932 to 1972, the U.S. Public Health Service deliberately withheld treatment from hundreds of black men with syphilis in Alabama's Tuskegee study, telling them they were receiving free health care while secretly observing the disease's progression, violating medical ethics for 4 decades and causing preventable deaths and suffering. From 1944 to 1974, driven by Cold War fears and scientific ambition, the CIA conducted MKUltra experiments on unwitting subjects using LSD, torture, and psychological manipulation to develop mind control techniques, destroying lives and causing permanent mental damage across psychiatric hospitals and universities. In 1953, to test biological warfare capabilities during the Cold War, the U.S. Army secretly released bacteria over San Francisco, exposing 800,000 residents to potentially harmful pathogens without their knowledge or consent, treating an entire city as a laboratory. From 1946 to 1948, U.S. government researchers deliberately infected Guatemalan prisoners, soldiers, and mental patients with syphilis and gonorrhea to study transmission and treatment, exploiting vulnerable populations in experiments that violated basic human rights and medical ethics. From 1963 to 1973, CIA psychiatrist Ewan Cameron conducted psychic driving experiments at Montreal's Allen Memorial Institute using electroshock therapy, sensory deprivation, and drug cocktails to erase patients' memories and rebuild their personalities, funded by the CIA's MKUltra program. In 1950, the U.S. Navy sprayed bacteria over San Francisco Bay from ships dispersing Serratia marcescens and Bacillus globigii to study how biological weapons might spread in a coastal city, using civilians as unknowing test subjects in a massive biological warfare experiment. From 1955 to 1975, the CIA's MKUltra Subproject 68 tested extreme interrogation techniques on psychiatric patients in Canada, using massive doses of LSD, prolonged sensory deprivation, and electroconvulsive therapy to break down subjects' personalities and implant new behaviors. From 1951 to 1974, the U.S. military conducted Operation LAC, spraying zinc-cadmium sulfide over major cities including Minneapolis and St. Louis to simulate biological weapon dispersal patterns, exposing millions to potentially toxic chemicals without public knowledge or consent. In 1966, the U.S. Army released bacteria in the New York subway system to test how biological agents would spread in an urban environment, turning the city's transportation network into a laboratory and exposing countless commuters to experimental pathogens. From 1942 to 1945, Harvard researchers working with the Office of Strategic Services tested truth serums on psychiatric patients and prisoners, administering marijuana extracts, barbiturates, and other drugs to develop interrogation techniques for wartime intelligence gathering. From 1944 to 1946, U.S. researchers at Stateville Penitentiary deliberately infected hundreds of prisoners with malaria to test new antimalarial drugs, using incarcerated men as human guinea pigs in exchange for reduced sentences and payment. In 1953, CIA operative Frank Olson was secretly dosed with LSD during a work retreat as part of MKUltra testing, leading to his psychological breakdown and suspicious death from a hotel window 9 days later, demonstrating the program's lethal consequences on unwitting subjects. From 1962 to 1973, researchers at Holmesburg Prison in Philadelphia exposed inmates to chemical agents, viruses, and fungi in over 150 experiments, paying prisoners small sums to endure painful procedures that left permanent scarring and health problems. From 1946 to 1956, the Atomic Energy Commission funded researchers to feed radioactive materials to mentally disabled children at the Fernald School, telling parents it was a nutrition study while actually testing radiation's effects on developing bodies. In 1965, the U.S. military sprayed vulnerable populations in Oahu, Hawaii with Bacillus globigii to test biological weapon dispersal over island terrain, using local residents as unknowing subjects in biological warfare research without regard for their safety or consent. From 1963 to 1971, CIA contractors conducted sensory deprivation experiments on psychiatric patients in Oklahoma, keeping subjects in dark, soundproof rooms for weeks while testing the psychological effects of extreme isolation as potential interrogation techniques. In 1953, during the height of the Cold War, CIA researchers began Project Artichoke, using hypnosis, drugs, and torture on subjects to create programmed assassins and extract information, violating international law and basic human dignity in pursuit of mind control capabilities. From 1957 to 1964, Soviet researchers subjected political prisoners to extreme cold exposure in Siberian labor camps, monitoring how long subjects could survive in sub-zero temperatures while testing limits of human endurance for military applications. In 1942, Nazi physicians at Dachau forced prisoners into freezing water tanks and exposed them to high altitudes and pressure chambers, conducting hypothermia and aviation medicine experiments that killed dozens while providing data for German military operations. From 1941 to 1945, Japanese Unit 73-1 conducted biological warfare experiments on Chinese prisoners and civilians, deliberately infecting thousands with plague, cholera, and anthrax, while performing vivisections on living subjects to study disease progression and biological weapon effectiveness. In 1961, during the height of apartheid, South African military researchers tested chemical and biological agents on black prisoners using racial minorities as expendable test subjects, while developing weapons for use against liberation movements and civilian populations. From 1950 to 1953, British researchers at Porton Down exposed military volunteers to nerve agents including sarin gas, telling them they were testing common cold treatments while actually studying chemical weapon effects and killing at least one participant. In 1964, Soviet scientists conducted sleep deprivation experiments on political dissidents, keeping subjects awake for up to 1880 hours while monitoring psychological breakdown patterns for use in interrogating prisoners of state. From 1958 to 1962, CIA researchers tested experimental drugs on psychiatric patients at Mount Sinai Hospital, administering untested compounds to vulnerable subjects without informed consent while documenting severe psychological and physical reactions. In 1954, East German Stasi operatives conducted sensory manipulation experiments on political prisoners using strobe lights, loud sounds, and isolation chambers to induce psychological breakdown and extract confessions from dissidents. From 1945 to 1947, American researchers injected plutonium into hospital patients at Rochester, Chicago, and Oak Ridge, telling subjects they were receiving new treatments while actually studying radiation absorption and excretion in human bodies. In 1962, the U.S. Army tested psychochemical weapons on soldiers at Edgewood Arsenal, exposing thousands of military personnel to LSD, PCP, and other mind-altering drugs to develop non-lethal weapons and interrogation aids. From 1963 to 1966, researchers at the University of Pennsylvania exposed black inmates to massive doses of dioxin, the toxic component of Agent Orange, to study skin reactions and cancer development while targeting vulnerable minority populations. In 1952, British researchers deliberately infected mental patients with hepatitis to study the disease's progression, using institutionalized subjects who couldn't consent to dangerous medical experiments that caused liver damage and death.